Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast, brought to you by RipsyTech. I am one of your hosts, RipsyTech product manager Parker Anderson, and as always, I am joined by RipsyTech founder and CEO, the wise Tom Tarshis. Hi, Tom.
Hey, Parker. Thank you for that nice introduction.
You're very welcome. So, Tom, this week of the podcast, we wanted to talk about kind of a unique topic that may not be that much of a unique lived experience as some people might think, and that is working as a mental health provider with a close friend or family member. And I think there's maybe a few different situations in what and how that could happen. So let's dive into that to start. So my first question for you would be, in what circumstances might a mental health provider be working with a family, friend, or partner?
Yeah, and this has been true for myself and several practices, but I think because in this field, a lot of people do go into private practice or start small groups. This is a common occurrence, and we can even say, Parker, from some of our RipsyTech clients, there are numerous couples, friends, close relationships in a lot of the clinics and groups that have signed up to use our product. So that's a little data to validate my generalized statement that I think we're prone to have these situations because of starting practices.
Right.
And I think, from a basic example, anytime someone's starting a small business on their own, it does tend to be a family affair. So they might look to anyone with skills in their immediate family who can use them to help with the business. So you might have a mental health professional who's not great with technology, but their younger brother or their sister-in-law is good with technology and can do their website. And they may have someone who's good with accounting or keeping the books, or someone who has time to be an office manager. But a lot of people in this field or physicians meet their future partners via school or training or interactions along the way to the finishing your training. So you might both be mental health professionals and want to start a clinic together. And we definitely see that all the time. In general, it's an interesting, we have these things in our country that are, family businesses, right? They advertise family-run restaurant or, auto repair shop, family owned and run since 1948. And it is something that goes on a lot of businesses, that they are family businesses and they use it as a selling point. But then there is this secondary piece around nepotism, or you shouldn't work with family. And so I've always, been interested in that duality of this sort of family, close relationship, working together situation. And I think as I found out, there is a big difference with respect to the size of the company that you're running, and different checks and balances that come into play once your company gets to a certain size. And we can talk about that a little more later.
Yeah, I mean, as you said it really did kind of make me think we do meet a lot of providers who are, maybe they're a couple together and they're part of their own practice that they run together. Maybe one of them is the provider and then the spouse is, doing a lot of the admin or billing work. I mean, it made me even think about, so my partner is my wife. She is expecting a child, and we decided we wanted to get a doula. And when we were interviewing doulas, one of the doulas that we met, her partner is a chiropractor, and there's like special deals for like pregnancy chiropractics if you're interested, that she was offering. And it's so, I think it just kind of speaks to, people are always, if it makes sense to integrate their partner into their own small business in a way that's, mutually beneficial, then, it's likely they'll do it. So, interesting thinking points. But I hear you that, the dynamics certainly become different when you get to be a larger sized entity. And certainly, there's nepotism to be thinking about, and, management versus, I don't know if ground level employee is the right term here, but, a non-management employee and relationships there. But I don't know if you just mentioned this or if, but you were mentioning this earlier of how, before social media and dating websites and everything existed, most people, the only place to meet people was at your work, because your work was kind of your whole life. So, lot to ponder here. So let me pause there.
Yeah, I mean, not the only place to meet people. I mean, people
not the
go
only
to bars or church, school. But I think that I do think there was a period where that was the number one source of marriages came out of people who met at work for a period of time. That is definitely not true any longer. But as there are certainly lots of workplace romances that happen and that can lead to then partnerships or marriage or relationships. And I think, if you're already married or already partnered up as you're starting the company together, it's definitely cleaner and easier. I think that if a situation arises where you connect with someone, after a business has started, and then roles change for the person connected with, then that's where sometimes things can get tricky.
Certainly. I mean, if the CEO of Google suddenly said, "Hey, our new COO is my wife," that might raise some eyebrows, right?
Yeah, and I would, just to pull some more specific examples. So I've had both of my sons do some work for the nonprofit when it was a fairly large size, and what we needed to do was needed someone with computer skills to transfer files over from a system we had used previously to a new system. And so at the current company, there was really no one with that level of computer skills to do that work other than myself. And it was not something that I wanted to necessarily spend my time with, but I knew that my kids had that skill set. And I remember, my older son being, I can't work for you. That's nepotism, which is not the correct definition of nepotism, because, bringing in a family member or friend to do a specific task that only they have the skills for and there's no one else that can do, that's not nepotism at all. And sort of what nepotism really is passing over someone who's more qualified to do a job or position, and or giving that person special treatment or promotions that are non-deserving because of the relationship they have with you. So it is important to make that distinction.
Yeah, I mean, it makes me think about my dad actually called me up the other day. He's retired, but he's kind of, he's got his own ideas and his own people that he talks to with their own ideas, and that's
dangerous for retired people to have their own ideas.
And they were thinking about like, this idea that we have, how would that get designed? So he actually called me to say like, hey, you do a lot of like the user experience design, and your partner, my wife, she does a lot of user experience research. So he kind of wanted to share his thoughts and kind of pick our brains and, just to kind of, light the match or light the spark. If there's anything that we can potentially help him out with down the line, just being like, the first people that he thought of, like the first people that he could think of that do that type of work. And then it also, it makes me think about, like, I met my wife at grad school, and, so we both kind of went into doing similar things. So then the idea of, like, might we potentially one day have our own side business doing user experience for, freelance user experience for clients? It's not out of the question, and it makes sense as, a small business, husband and wife doing something together as a joint venture. So, there are so many different ways that this just kind of can naturally appear in life.
Yeah. And I think, I will say when you're treating patients where there are sort of these extra, HIPAA protections and confidential information and sort of these extra precautions that you have to take with patient files and patient records, it probably does bring a little extra layer to this working with friends or family situation that you want to be mindful of. It's not, any business, I think, with very sensitive information is potentially different than, say, working at a restaurant. Though,
right.
Maybe not, but, so for these different, and we have different practices. I have friends and where we have the situation you mentioned where maybe one of the partners is the office manager and the other's a clinician working in the group. And, the clinics, they don't necessarily hide this information. In fact, you can see the same last names sometimes for people who have the same last names. And, I think for when these groups are hiring employees, it is important to disclose relationships among, the people who are founders or running the business that may exist. And I don't think there's been any secrecy around that for the different people I know who've started companies. And it's sort of like, here's my spouse who's the office manager and takes care of admin and billing. And I'm the clinician here. So I think being very clear with employees, even if you're small, but you're hiring employees, that should be known. But then there is this question of, if you're a very small group, should your patients know that, hey, the office manager and the doctor are partners, or those two clinicians are living together? And I think I don't necessarily think there's a right or wrong answer there. I wonder, what would your thoughts be on that?
Well, I think my first thought would be, whether the patient would ever need to interact with both of those people. I feel like most people that you do interact with as a patient is like maybe somebody at the front desk, and then, at any kind of like typical, or well, I shouldn't say typical, I guess non-mental health related facility, I would maybe see like a nurse first and then a doctor. Or if I'm at the dentist, it's like the hygienist and then the dentist. When I see a mental health provider, it's usually just like the front desk and my provider, maybe a billing person, or a financial advisor, or I forgot the term that we had for that.
Financial counselor.
Financial counselor. Thank you. So, unless the relationships, intersperse between those people, I maybe wouldn't see it to be totally necessary to disclose that. I don't know. In my mind, it comes down to the patient experience. If I am a part of an intensive outpatient program and my therapist and my psychiatrist are married, then I might want to know that, just those are the thoughts I have on the top of my head.
Yeah, and I think, if you're a patient coming in and in mental health practice, you're maybe disclosing some very personal information. I think it'd be normal to, if you heard like, oh, those two clinicians are together, is my therapist going to share that story I told about, what happened when I drank too much, or about when I was molested at a young age, or something very, very personal like that. That's a very reasonable thought for anyone to have. And of course, if the clinicians are maintaining appropriate ethics and boundaries, there absolutely should not be disclosing any of that information. It's sort of the same thing around, and there's been, the stories that get news coverage is, say, when a star is treated at a hospital and someone inappropriately accesses their medical records and sort of shares that information, and that is a serious no and crime, and that stuff gets publicized when that happens. So being clear, I think, about addressing concerns about any patient may have about general privacy and confidentiality of the information, which we do anyway, and people should do, but and just keeping it real at our nonprofit right now, it is my spouse and myself and another clinician, and we're going to be adding more people. We have different last names, so I would say the majority of people don't know that we're a couple. Even at our old company that we worked at, I would say the majority of employees didn't actually know that we were together. And that makes me feel good when it's a verification of the professionalism. And of course, it got to a point where I was doing very little clinical work and was sort of sitting in the office doing business stuff. My partner was seeing a lot of patients. So it wasn't that sort of interaction around other patients or clinical error, things like that, which I think helped that situation. But certainly right now, what happens is you tend to get shared patients, or hey, there's a sibling that needs to be seen or a parent that needs to be seen. So we do have these shared cases. We're not secretive about the relationship, but we don't go around advertising it. But certainly if someone asked about it, and some people know about it, there's not, yes, we are married, and tell me any questions, concerns that you have about that situation. And usually it's nothing like, usually people are, it's a little bit of gossip, or from a patient level, like, oh, did you know that they're actually seeing each other, sort of thing. But
well, maybe even at the employee level too, if they didn't know.
Fair enough.
Fair enough. Yeah, but that makes sense. Well, yeah, both you and your partner are psychiatrists. So I think you just mentioned this, but so you do have some shared cases together?
Yeah. So and our the whole approach to mental health treatment is, especially with kids, is you can't just treat the kid in a vacuum. You have to treat the family unit. Right. And since we try to do best practices and hold ourselves to a really high standard, if we see a kid who's struggling, but then one or both of their parents needs help or a sibling needs help right now, because our practice, we're starting, our practice is small. So that means there's very few of us to share the cases with. So often we will see if there's availability to see another family member, and then that connection happens. But yeah, again, like, especially now, while there there are very few people that know about the relationship status. We work very hard to keep it very professional. I may be naive about that because I think you can go on Google and like Google people's names, and it's not hard to uncover something on the web that, shows you own a house together, or it might be an old wedding website still indexed somewhere that people can find. So
Right. Okay, so we've talked a lot about, we wanted to talk about, ethical concerns, boundaries, transparency. I feel like we've touched on those themes quite a bit. So I'm thinking, and we did want to talk about, challenges and benefits that come with starting a practice with a spouse, and how couples might balance business and personal dynamics. So actually, let's talk about that. Let's talk about, the dynamics between the spouses. Maybe, so we've covered a lot about like the patient experience, maybe what the, other employees might need to know. But yeah, what if that, as for you as somebody who is living in that experience, how do you go about maintaining that balance between, your professional and your personal lives?
yeah, and right, and this we talked a lot about professionalism and presenting things properly to patients, but this is actually the bigger topic for anyone going into business with a partner or a friend, because there is a lot of caution and care that needs to go into this to not destroy both your business and your personal relationship. And so and the mistakes that happen are oftentimes, everyone sort of pitching in, doing everything at first, but then people don't pay attention to the conversations about role differentiation and responsibilities. And it can get it's much like managing your personal household. Like if you've never sat down and kind of like, okay, I'll take care of the cooking, you're doing the laundry, and we'll take turns on the dishes. Like for couples that don't work on the division of labor, we know that resentment and other problems can arise when one partner feels like this is not what we agreed to, or I'm doing most of the work, and then bring in a business where you're generating income and revenue. And if you haven't defined those roles, then it gets can create lots of problems. And like good examples are, who's going to be, if you need to finish your notes to submit to insurance, or you need to deal with collecting money, who's going to take the responsibility for some of these, intense pieces of the work that you're doing. And if that is falling on one partner and you haven't ultimately discussed that at first, that can definitely start to create tension in the workplace. And of course, if you're working together and then you're living in the same house, it definitely can spill over and ruin those relationships. And there are some statistics on, results of working together with people that you're in a relationship with respect to outcomes in marriages and other relationships. And I don't have the numbers off the top of my head, so I don't want to quote them, but it all comes down to this point that, once you're past sort of this launching phase and it seems like this is going to be successful and part of your life, you really need to have those sit down conversations where you assign roles, and you also think about tension spots between the workload and who's doing what with the business, to help avoid conflict and disasters. And I think it's easier, for some of the people we work with where one partner is the business manager and the other's a clinician, like that's a nice kind of role separation. There can be a little bit of tenseness if the clinician's not doing their work properly, and that's affecting your role running for the business manager. But
right.
I think it can be more of an issue if both people are sort of sharing the same roles as you're getting the company launched.
You think so?
I think so. I mean, this is very like subjective based on
Yeah, it's
sound.
all speculative. Yeah, I'm just thinking to myself, like, if you do the same work, the same type of work, then you might have an easier time, well defining, the scope of work, or at least finding a balance. If there's something outside of the main thing that you do that you are responsible for, that maybe they would also have something outside of the main things that you share that they would take on as well. But then when there's like both doing separate things, there's a lack of understanding potentially of what it takes to do that thing. That's just something that kind of might come up in regular workplace dynamics, but so that's just kind of why I speculate, playing devil's advocate for how it might be on the other side.
Yeah. No, yeah, fair enough. And I think my comment was sort of in with reference to, like, if you have two clinicians starting a practice together and they're seeing patients and then they have to sort of share the admin work between them, I think that can create problems without clear definition of who's calling back the patients who want appointments versus who's charging the credit cards. And so that's maybe not a strength for either partner. And you've got to kind of define, instead of, well, let's try to do it together, which is not recommended, trying to define roles that maybe neither partner is that skilled in, that can create issues.
Okay, well, any other notes on this topic before we want to move on?
Yeah, no, I mean, I think professionalism and honesty and transparency are kind of what are the right principles for anyone to follow through in workplace settings or professional settings. And as long as you stick to those, you're okay. I think it can be fun to start a practice with your partner, assuming the relationship's good, and it can bring people closer together. It's just the same advice we give to our couples we see in couples counseling, making time to sit down and, the advice for couples is block an hour or two each week where you can spend that time together to talk about anything important and relevant in the marriage. You also, if you're working together, need to have a company meeting for an hour a week to talk about what's going on with the business and how things are going. And don't be tempted to sort of blow off that meeting just because you live with each other or in a relationship. In order to make it successful.
Yeah, I imagine there might be less volatility going with two mental health providers who are married, going into business with each other, who are maybe experts at couples counseling, than perhaps in a separate industry where that might not be the case.
Although you'd be surprised, like people are. You're always much better at working with others than working with the things you need to improve on in your own life. So there's some truth to that. All right. Well, do we have a mental health business moment of the week for this week? Let's see. Do we have anything from this week? And this is, I try to think and plan a little bit ahead of the podcast. And full disclosure, I didn't think about too much. Things have been, I would say that, when the company, I'll just use it to point out that once you get to a certain point within your practice, it is important to bring on other people to help with some tasks that you may not have time for, or that paying attention to money well spent to hire others. So we brought on a billing person who, we've known for a long time to take over submitting the bills and following up with insurance companies. And that's been super helpful and money well spent. And then just this week, I've reached out to bring on someone else to help start with job postings and credentialing and other aspects of work. And as soon as lots of times when you're starting something yourself, you want to do everything on your own, but being able to take the step back and bring in others. And even though it means you're paying money out to other people, the savings in time and having someone who's more knowledgeable and more experienced doing a different task is well worth it for your company. So, it's sort of a general business topic of the week, but
yeah, it could be. It sounds like it could be money well spent for both the health of the business and for managing stress levels of the employees as well.
Very true. Yes.
All right. Well, sounds great. I would say there you have it. Thank you for joining us on this week's episode of the Sit and Stay podcast, brought to you by RipsyTech. If you have a question you'd like to submit to our audience Q&A, or you're interested in featuring as a guest on the show, which we might have a guest for the next episode we record, send us an email at sitandstay@ripsytech.com. All right. Tom, I will see you later.
Thanks, Parker. Take care.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.